So, if you have diabetes, you have likely heard of metformin. Or if you've been paying attention to the news in the last couple of years, you might have heard that metformin or large batches of metformin tablets were being recalled. Now, I'm not talking today about how bad metformin is, quite the opposite, actually. I want to talk about a lot of the good things that come from metformin. And in particular, I want to talk about how some individuals actually seem to lose weight when they take metformin. But before we dive into all of that, welcome back to the program, you beautiful people. My name is Dr. Dan. I am a pharmacist turned obesity expert. And of course, I want you to hit that subscribe button down below. I want you to tap it. I want you to subscribe so that you don't miss another episode that comes out from me. As well, turn on your notifications so you definitely get that notification piece that comes out there with it. As well, check me out on my other channels at the official Dr. Dan. I'm on the Instagram, the Tick, the Talk, the Book. You name it, we are out there. We are posting content there every single day so you can get the latest updates as to what I am talking about and what I got going on. And of course, if you need some additional support on your weight management journey, check out my website, healthcare.evolve.ca, where you can book a free consult with myself and you can book in to, see if you're a good fit for our program. So the first thing that I want to address here is that the reason metformin or large batches of metformin tablets were being recalled was not because of metformin, the molecule itself, causing something bad. It was because large batches of metformin tablets were found to contain a potential contaminant. And this contaminant is considered a possible carcinogen. So it might, in the right concentrations or concentrations that are high enough after a prolonged exposure, lead to cancer. Now, fortunately, all of these drugs, and a large majority of just about everything that is used for human consumption, undergoes a quality control testing all of the time. And the reason for this quality control testing is in order to find different things like this that might not or should not be within these tablets or various other products. So the potential carcinogen causing component or contaminant that was found within these metformin tablets hasn't been there for years and years and years. It was only just recently found, and it was found via quality control checks. And now all of the batches and tablets that were found to have this carcinogen have now been pulled from the market so that humans are no longer receiving them and getting them. Now, fortunately, if you happen to have a batch or, a vial of metformin tablets that was found to have this potential carcinogen in it, or you took, say, an entire vial of that medication and then were given a call, hey, your drug might have had some carcinogen in it. Not to worry, not every single tablet seemed to have this potential carcinogen, and if they did, it was in a very, very low concentration. Further, when we say it's a possible carcinogen, again, not everybody is going to develop cancer who becomes exposed or gets exposed to this carcinogen. It's only going to possibly cause it in some individuals, and again, it has to be in a high enough concentration and over an extended period of time, neither of which occurred in this situation. It was found in very low concentrations, but it was high enough that, hey, we need to pull these drugs from the market so that someone doesn't get exposed to this long term. But of course, if you have any concerns in this regard, please follow up with your care team and your care provider. All right, let's dive into the good stuff here. So metformin belongs to a class of diabetes medications called biguanides. And metformin is currently the most widely prescribed diabetes-based medication. And in fact, it's one of the most widely prescribed medications across the globe. And that's because it's hella good at what it does. Real hella good at what it does. Not only has it been around since the 1950s, so we literally have a mountain of data around the safety of this medication and how good it is, but we also have a mountain of data that shows all of these plethora of beneficial effects that the metformin molecule might have in the body. Everything from protecting your brain, your heart, maybe having some anti-aging properties potentially, and even helping conditions like polycystic ovarian syndrome or PCOS. And further, as more and more data comes out around metformin, one could almost make an argument that literally everybody should maybe be on some amount of metformin for the beneficial effects of this medication. At least to say the beneficial effects outside of just managing blood sugars in diabetes. And for the haters that I know are going to leave comments at the bottom of this video, no, I am not paid by Big Pharma. In fact, I very much would accept a payment from Big Pharma for my student loans that I currently have piled up. Yes, I know I keep bringing this up. It is a stressor of mine because I have hundreds of thousands of dollars of student loan debt. and it gets really old saying that I'm a paid actor. The unfortunate piece here is that nobody is making money on metformin right now. These tablets probably cost more to make than what they're actually being sold, or you have to make so many of them in such large amounts to make any kind of cash flow off of them that literally no one's going to give whatever little profit they have left over to some lowly pharmacist that's making YouTube videos about it. And that's like including in the States where the price of drugs are absolutely ridiculous. The cost of metformin in the States is like minimal compared to other medications. Anywho, metformin and weight loss. So metformin's main mechanism of action is reducing insulin resistance. Thereby, the insulin that your body does produce, and insulin is the hormone that our body releases when we eat a meal, when our blood sugar levels are high, in order to bring our blood sugar levels down. And so what it's doing is that the insulin that your body is producing, it allows it to work more easily, to be more effective, if you will, so that it can open up the doors on our various cells and allow the sugar that is in our bloodstream to go from the bloodstream to inside of the cells, so that our cells can do the cell things that they need to do, such as running our body, keeping our brain functioning, all of those beautiful things. And by doing this, it helps to bring our blood sugar levels down, helps to control our blood sugar levels, and ultimately manages diabetes. However, some other hormones that metformin has been found to act on are, number one, the GLP-1 hormone. So it seems to allow for the increase of GLP-1 in our bodies. It also acts on a hormone called GDF-15. And if you've been following me for a little while now, you'll know that GLP-1 is the hormone that is found within the medications Wegovy, Ozempic, Saxenda, Trulicity, and that sort of thing. And that the GLP-1 hormone and those medications are not only very good at lowering your blood sugar levels, but they're also very effective in weight management because they act within the brain and help us to reduce our wanting and our food-seeking behaviors. So if metformin is increasing the levels of GLP-1 in the body, you're likely or potentially going to get some blood sugar lowering effects for sure, but it might also have some effects in the brain in decreasing your food-seeking behaviors, thereby getting you to eat less, thereby helping you to lose weight. But what about GDF-15? What does that hormone have to do in the whole mix of things? And that's where things get really interesting, because a recent paper found that metformin increases the levels of this hormone GDF-15, or growth differentiation factor 15, which we've also come to find is a satiety hormone, or helps us to feel full. And what the authors of this paper found is that when GDF-15 levels were increased by metformin, there was a mild correlation with weight loss. And what the authors found is that the participants that were taking metformin lost approximately 3.5% of their baseline body weight compared to the placebo group. Now, we don't know all the ins and the outs as to how GDF-15 might help with the satiety weight loss process, but what we seem to think is going on is that it does have some action or mechanism within the brain, similar to GLP-1, but maybe in some slightly different areas, that ultimately helps to reduce, again, your food-seeking and wanting behaviors. Now, we don't know all the ins and the outs as to how GDF-15 seems to work, but it does seem to have a role within the brain, and in a slightly different area compared to, say, GLP-1. It seems that for weight loss, it helps by acting in a brainstem-mediated receptor of some kind, and ultimately decreases your food-seeking and food-wanting behaviors, which I personally think is pretty darn cool, and really is showing again that obesity and our satiety, appetite, and eating behaviors are extremely complex, and we're only just starting to scratch the surface as to everything that is going on there. Now, I want to say a big caveat here because, again, I'll have another group of people that come in my comments and say, I've been on metformin for years and years and years and haven't lost any weight. And yeah, not everybody is going to experience this effect of the GDF-15 hormone increasing, and thereby not everybody is going to get a weight loss benefit from taking metformin. However, some individuals that are taking metformin may full well enjoy this potential benefit. I also want to mention that metformin is currently not being used as a standalone agent for obesity and weight management. Now, the other thing that I need to mention about metformin here is that metformin is not currently being prescribed solely for weight loss and weight management. While it does have some evidence for weight loss, weight management, and that sort of thing, it would currently be considered off-label prescribing as per FDA, Health Canada, and the other regulatory bodies that have approved this medication to be on the market. So if you are prescribed this medication for, say, other reasons such as anti-aging, for weight loss, for what have you, it would be considered off-label. This would be a bit of a gray area. I'm not saying that there's not clinicians out there that are doing it. There certainly are. I have prescribed metformin in the case of individuals that are on antipsychotics. They don't have diabetes, but they have been gaining weight, or we're trying to prevent weight gain due to the antipsychotic medication, because that antipsychotic medication is more beneficial for whatever condition it is treating. And so we would want to mitigate and manage that aspect. So it is off-label prescribing. Anytime it's off-label, there is a gray area. There is some potential issues of running into problems around if something does go wrong and that sort of thing. So you're not actively seeing it prescribed for weight loss at the present time. And I'm doubtful that metformin will ever get an indication for weight loss or weight management in the future. The reason being is that someone needs to submit all of this data and information to the FDA, to Health Canada, and that sort of thing. And if it doesn't make business sense where, say, a company is going to make money off of a said medication, well, they're probably not going to do it. And as I said previously, no one's really making money on metformin anymore. It costs pennies on the dollar for an individual to purchase metformin. So we're likely not going to get that indication, and it's likely going to be off-label. Further, the weight loss benefits that did come with metformin for some people were relatively modest at only about 3.5% of their baseline body weight. Generally, when we're looking at a weight management, obesity management medication, we're wanting to aim for at least 5% body weight loss. There is still some benefits that can be conferred at 3.5%, but it's not really enough to say this is a sole weight loss, weight management medication. Generally, we want to see it over that 5% mark to really say it is providing a benefit in that regard of obesity and weight management. So unless you have PCOS, another extenuating circumstance, or what have you, where a physician or clinician can make the argument to prescribe this medication, you're likely not going to get it prescribed by your general practitioner or family physician. Maybe a specialist, but again, they're likely seeing you for some other potential reason. Now, one final note on metformin. Yes, metformin definitely can have some side effects, in particular those that are GI in nature. Sometimes the long-acting version of metformin called Glumetza can be more beneficial and cause less GI distress. Not everybody is going to get this GI distress, and if you take the medication with food, it can mitigate it. But some people definitely do get these GI side effects, and sometimes they're intolerable and they need to stop the medication, which it's totally okay if that is the situation. And finally, because I know there's going to be 1,000,001 comments about how metformin destroys your kidneys, destroys your liver, does this, that, and the other thing, blah, blah, blah. Yes, there are very, very small risks with metformin in potentially causing a condition called lactic acidosis. Again, this is very, very rare, and most of the data around this lactic acidosis was seen in the case of fenformin, which was a kind of a sister molecule to metformin, which has now been pulled from the market. Metformin has been shown to cause that in very, very rare circumstances. Generally, there's something else that's going on that ultimately leads to this condition. In terms of kidney and liver stuff, yeah, we dose adjust metformin in those situations if you already have kidney damage or liver damage, because we don't want metformin to build up in your body and lead to that lactic acidosis. It's not that the metformin is causing the damage itself. Likely, potentially, more often than not, if you will, the condition that we're treating, such as diabetes, has led to that damage already to things like the kidneys. So it's not the metformin itself that is harmful. It is other conditions that we're ultimately treating that are likely contributing and causing that issue. And in fact, once again, there's been good evidence to show that metformin may actually be protective of your kidneys, your liver, and your heart. So for a vast majority of people, metformin has been shown to be very safe and very effective with 70 plus years of data to fully back it up. A lot of drugs haven't been on the market that long and have that much safety data behind it. Metformin is definitely one of the rare ones. So we can be very sure is a very safe medication if you are able to tolerate potential GI side effects that might come with it, which a vast majority of people are. Anyways, that is enough of me ranting and being on my soapbox. I've posted other videos and stuff like that on this and have just gotten a parade of various comments. So I just wanted to make sure we hit on every single point. And hopefully the individuals that are going to leave the comments ultimately listen to the entire video and will make some kind of coherent argument instead of just saying whatever in the comments. If they do, well, it is what it is. So metformin is a interesting, wonderful, fascinating little molecule. As I said, it is very effective at what it does, and the plethora of benefits that come with metformin is continuing to grow every single day as we get more and more literature and research out there. Some people might even get the weight management, weight loss benefit because of its activity at the GDF15 hormone and increasing it in your body. So there is that potential benefit that comes with it. But other than that, metformin is a very effective diabetes medication and will continue to be our first-line therapy in that regard for many years to come. That is all for today, you beautiful people. As always, don't forget to hit the subscribe button down below. And of course, check me out on the other channels, the Instagram, the Facebook, the TikTok, the tweeting, you name it, I am out there. Go and follow me at the official Dr. Dan. And of course, if you need some additional support on your weight management journey, go to my website, healthcare.evolve.ca, book a free consult with myself, and we can see if you are a good fit for the program or not. And as always, don't forget that small tweaks lead to massive peaks. Until next time.